Hello, everyone, and happy Sunday, and welcome to Say It Sunday. So, I'm your host, Angela McGowan. I'm your professional healthcare advocate, caregiver strategist. Yes, and I am the author and publisher of What You Don't Know Could Kill You: How to Get Out of the Hospital Alive. And I am the founder of Angie's Pace, as patient advocates committed to excellence. So, welcome to the broadcast. Thank you for joining me. I certainly hope it has been an awesome Sunday for you and for your family. You've enjoyed this entire weekend. That would be wonderful. And you still have some Sunday left, especially if you're on what? The West Coast, because it's not quite that late yet. It's only, well, it's just about 5:30, so I think I'm on maybe 1 or 2 minutes earlier. So we've been focusing on Medicare and Medicaid for this entire month, and this Sunday will not be any different. But first, as in every Say It Sunday, we want to start with two things. And we want to honor our caregivers and say what? Thank you. Thank you, caregivers. Thank you for being who you are on a daily basis. Being a caregiver is not something you can pick up, put on, change around, but no, it is part of you, who you are. It becomes part of your being. And so thank you for being selfless, for being accommodating. Thank you for being so patient and so loving. Thank you for thinking of others first. Thank you for making things happen when it seems like it's not going to happen. And so if no one said anything to you this week, and I know it was surely an accident, allow me. It's my honor to say those two words to you, caregivers, and that is thank you. And you are so appreciated. And when I say what? You're absolutely irreplaceable. Absolutely irreplaceable. Thank you, and thank you. All right, so we're going to start today. We'll actually complete our focus for CMS, who's really in charge, who's running it, and that is the Center for Medicare and Medicaid Services. And so today we're going to really talk more about Medicare, but as Medicare goes, so Medicaid will follow. But in this instance, and let me just say this, if you're on Medicare, if your parents are on Medicare, your grandparents on Medicare, if your neighbors on, if you know anybody on Medicare, whether they're on Medicare Advantage, regular Medicare, it doesn't matter. You need to get this information because Medicare is doing a lot. Okay, they're doing a lot to make sure that your out-of-pocket expenses increase dramatically. And the sad thing is, most people are not even aware of it until they get out of the hospital and make the attempt to go to skilled nursing and find out that they will not be able to go. They have to go home. And so that is going to make for more returns, emergency visit. It's going to be more critical care, and it's going to result in some deaths as well, because those that do not go to skilled nursing but need it do not go home to anyone who can do the same thing. And sometimes they're going home to no one but themselves, and it's absolutely not possible for them to really care for themselves. So let me tell you what is going on, and let me see if I can post it. So the CMS has an administrator, and her name is Seema Verna, okay? She's the administrator of CMS, Center of Medicare Medicaid Services. And if you want to find out about her, what she's thinking, what she's doing, what she is going to cause to happen to you and those that you love, you can go to www.medicare.gov/leadership, and that will take you to all the people that are in charge of this of Medicare. Yes, CMS. So today I wanted to read a little bit to you and explain some things that are going on. So this information I received, actually I saw it flash across the Medicare information that I belong to, And it said that there was going to be a problem with people in conjunction to what SEMA Verna is proposing in order to decrease cost, that hospitals were going to be mandated, as it were, to not admit a patient into the hospital, but to keep them on observation status. They'd be in the hospital, and they could be in the hospital for several days, but not admitted, just on observation status. And let me tell you how critical this is to you and to those you love. What is really happening with Medicare? So the Center of Medicare Advocacy, who put this information out, is saying that they are part of other coalitions, okay, that are trying to pursue a nationwide class action lawsuit that seeks to establish a way to appeal the placement on observation status to Medicare. All right, so they're already in the midst of working on it, because this has been going on for a while. What is observation status? Observation status is a designation used by hospitals to bill Medicare. You might think, well, what's wrong with that? I'm coming to it. People who receive care in hospitals, even overnight or for several days, may learn that they have not actually been admitted. They are not actually inpatients. Instead, the hospital has classified them in observation status, which is an outpatient category. Now, this designation can happen for people who are extremely sick, spend many days in the hospital. It's not by what is diagnosed of you. It is strictly done because the hospital is in alignment with the CMS and their new program. So we've heard of people, this is what they're saying, that have had pelvic fractures. Okay, now you know, pelvic fracture, they are not inpatient. They are on observation status. So as of March 2017, hospitals are required to give the patients the Medicare outpatient observation notice. It's also called MOON. Okay, within 36 hours, okay, if the patients are receiving observation services as an outpatient for 24 hours or more. Now, why is that significant? It is significant because when the hospital classifies you in outpatient status, which is what observation status is, then you as a patient will be charged for services that Medicare Part A, that's the hospital part, would always pay when you are admitted as an inpatient. Now, here's an example. Patients that are coming in may be charged, okay, because they're not on Part A, they're in observation, they'll be charged for the medications they take in the hospital room in the hospital. All right? So, and more importantly, imagine a pelvic fracture on observation status for 3 to 5 days. All right? You will not be able to obtain Medicare coverage if you have to go to a nursing home after the hospital stay, be it observation stay or not. It doesn't matter. You could be there for 3 days, 7 days, you won't not be able to go. So Medicare only covers the nursing home care for patients who have been inpatient for 3 days minimum. Observation status, 3 days, 5 days, 8 days, it does not count toward inpatient. Now, what does happen is outpatient observation status is paid for Medicare Part B. Okay, that's the part that pays for your doctor's services, and you attach D to that and you get your medications. But Medicare beneficiaries who are enrolled in Part A but not Part B, for whatever reason they don't have Part B, they will be 100% responsible for their entire hospital bill if they are classified observation status. So that means that as a consequence of all this, They will be paying for where they stay in the hospital. They will be paying for medications, any test, any specialty, any charge that would have happened that Medicare would have paid for as inpatient with Part A. It will be billed as Part B. And if you do not have Part B, you will be billed directly and be liable. So that's your parents or anybody who doesn't have Part B. So what needs to happen? As the patient, okay? That's why we have to be powerful patients. And you can go to my link tree that's at the heading and find out how to be part of the Powerful Patient Facebook group. But listen, you will be paying for aspirins. You'll be paying for any shots. If you say, okay, I want a flu shot, you're going to pay for that. If you, whatever goes on in any test, any x-rays, if you don't have Part B, you're going to be, and even if you do have Part B, if you have a deductible, if you have a copay, they're going to be coming to your room asking you for the credit card. Or you're going to have to sign something saying, yes, I will pay. And those bills will be no joke at the time of discharge. So I'm giving you this information because I want you to know who's in leadership of the CMS. We found out who's running Medicare and Medicaid. That's the CMS. But who's running the CMS? This is more information for you. It is so serious. This has been going on for a few years, and now it is, the proportion is huge. Listen, just this July of 2019, SEMA Verna already proposed making this like mandated, not optional, making it mandated that hospitals would put patients in observation status. Therefore, imagine you have paid into Medicare, paid all these years, so that if something happened to you, you would be able to be well taken care of. And now they're saying, take care of yourself again. You paid into the system, and now they're saying, paid into the system or not, you're going to pay even more. So you can go in the hospital on Medicare and not even be inpatient. You think that you're admitted because you have the wristbands. You think you're admitted because you're in a room. No. You need to make sure that when you are going into the room, you need to ask. You need to see the paperwork that says you are inpatient and not observation, because they can keep you in there for many days and you will still be in observation if you do not have Medicare Part B. Because inpatient, now you're being treated as an outpatient, as if you're in your doctor's office. So you know, procedures and things that are done in the doctor's office needs authorizations, needs copays, needs all of those things. You're going to be treated that same way in the hospital while you're in the hospital bed. And then if they find you need nursing care, you will not be able to get it free like you would if you had those 3 days. You will even be paying for that. And you know, that's going to make people not go who are critical, staying home, grandkids taking care of them, neighbors are taking care of them. And then that's going to force them to be an even more critical care. There are going to be more people losing their lives because of this situation. That is why I tell you it is so, so important to ask questions, but ask the right questions. Ask the right questions. If you come in through the emergency room and they say, we're going to send you upstairs, you need to know that you've been admitted. Because if you're just up there for observation, then you're going to have a bill. You're going to be paying, definitely. So listen, I don't want to be doom and gloom. I want to bring revelation, understanding, and knowledge to you and to yours. Because finding out that you have thousands and thousands of dollars worth of bills when you thought your Medicare Part A covered everything because you were inpatient, who wants to find that out? You're trying to recover. And then to find out Your recovery might have to be mandated at home, or you have to go live somewhere else with someone else to try to take care of you, because you are not eligible to go to skilled nursing because you did not spend the mandated 3 days inpatient. Ladies and gentlemen, this is becoming from serious to critical. And I hope that each one of you will go to Medicare's website, check out the leadership, and more importantly, you will go to the Medicare advocacy.org. They are advocating for your rights in Washington, that all of the years that you paid into, you would actually be able to collect those benefits 100% if needed. All right, so I want to thank you for joining me. Thank you to my replay viewers. And of course, special thanks to the caregivers. This is your day, your time. We honor and recognize you. I'm Angela McGowan, your professional healthcare advocate, your caregiver strategist, and I help you navigate through healthcare's sea of red tape. And I create strategies that would allow you to give excellent healthcare to those that you love and care for, as you care for yourself as well. Have an awesome Sunday. It's going to be Happy Monday, 9:05 tomorrow. You can join me right here. And I'm leaving you with those two things: blessings and joy. Why is that? Because they both belong to you. Have an absolute awesome evening and enjoy yourself. And I look forward to seeing you on the broadcast tomorrow morning. Bye.